Early detection can mean the difference between life and death.
Warning signs for lung cancer.
Cancer is a disease of the older person.
What is the importance of the early detection?
It's training your immune system to recognize a cancer that's been hiding in the immune system.
What kind of therapies are available today?
The right answer is we still are exposed to a lot of tobacco smoke.
Yeah, exactly. And the side effects are really hard.
They're terrible. Yeah. I'm old enough to remember there was a smoking section in the airplane.
Yeah, the lung transplant and cancer or non-cancer.
When people actually realize they have cancer, usually it's quite advanced.
November is Lung Cancer Awareness Month, a time to shed light on one of the most common and dangerous cancers in the world. But it's also time for hope, because medicine is moving fast, from early detection to new treatments that can help patients live longer and better lives. Today on Medical Dose, we're joined by Dr. Mohammed Fawzi Katranji, consultant pulmonologist at Al Zahra Hospital, Dubai, to help us understand more about lung cancer, its risks, symptoms, and the latest in treatment and medical technologies. Welcome, Doctor, and thank you for joining us in Medical Dose today.
Thank you.
Let's start with the basics. What is lung cancer?
Okay, wow. That lung cancer is really an abnormal growth of cells that start to grow uncontrollably and without response from your immune system. So they become detrimental to the lung and the way it works. And this is lung cancer. It's just an abnormal growth of cells in the lung.
Why it's the most common cancer in the world?
You know, I think the right answer is we still are exposed to a lot of tobacco smoke. People who are smoking and people who are secondhand smokers. Sadly, this is probably the number one reason for cancer, for lung cancer. Yeah.
So smoking.
And getting older. So the truth of the matter is cancer is a disease of the older person in general. It's a very rare disease in the young person. So smoking for a long period of time and getting older increases your risk.
Not only people who smokes gets cancer.
True.
Others can get cancer also.
I mean, believe it or not, the history of lung cancer is very long. And we know that people used to get it, again, just by living a long life. Of course, now that smoking is so widely available.
Unfortunately. Yeah. What are the main warning signs for lung cancer, let's say?
Warning signs for lung cancer are very limited. And this is why screening, I believe, is very important.
Yeah.
Because, we don't have that many nerves within the lung itself. So when people actually realize they have cancer, usually it's quite advanced.
Yeah.
Late stages. Yeah, late stages. People don't tend to have symptoms, but an abnormal cough that doesn't resolve, chest tightness, chest wheezing, that you've never heard before, all should justify some kind of evaluation by a doctor.
How often should people do screenings for lung cancer, let's say, or visit the doctors to check?
There is no perfect answer to this. Right now, we have a standard that if you smoke, depending on who you talk to, we have something called pack year. So if you smoke a pack a day for 20 years, we consider you a 20-pack year smoker. Initially, we would recommend if you're a 25-pack year smoking history that you should get screened, which is a low-dose CT scan of the chest. But I think people are moving towards 20-pack year, and people used to recommend it at 55, but I think the recommendation by most doctors is at 50.
50 to start screening yearly.
Yearly, and with initially a CT chest, a CT screen that is low-dose radiation, and a good way to find out if there's any kind of abnormal growth in your lung.
So there's so many kinds of the screening for lung cancer?
Not really. I mean, ultimately, the main thing when we talk about...
What is the best one?
Low-dose CT scan.
Okay. And how it works?
It's a CT scan where you have multiple kind of images that are kind of taken all at once to give you a 3D image of your lung. And it's like multiple X-rays. And what's amazing about technology is you don't really get exposed to that much radiation because the computer starts to regenerate what the lung looks like through algorithms that are, beyond my scope of expertise.
Yeah. What is the importance of the early detection?
Early detection can mean the difference between life and death. That's pretty straightforward. Early detection, you see a lung nodule, you suspect it's cancerous, you can maybe surgically remove it, surgically ablate it, and that is the end of the story. You have lung cancer, it is removed, it's out of the body, and you're great, you're free to go.
The other stages.
Yeah, so, I would, defer to the oncologists and the surgeons for perfect staging. But what you need to understand is you have stage 1, where it's localized and in one place, and then anything beyond that it's spread either to the lymph nodes, to the opposite side of the lung, in the blood, and ultimately this is what we call metastasis, that the lung kind of traveled in our internal highway. And, eventually these stage cancers, well, you got to treat them with chemotherapy, and we have other kinds of therapies.
What kind of therapies are available today with all this innovation and medical?
Obviously, we have to be up to date. Chemotherapy is the basic. This is cancer therapy 101, and this is ultimately poison to the body, where we're attacking the cells directly, and we're attacking the good and the bad cells. That's poison therapy. Surgery, we just mentioned, you can just surgically remove the cancer,
but these
or
are
ablate
specific
the cancer.
Cases to go only for surgery, right?
Right. But again, early stage. But then you're asking about the advanced. You have something called targeted therapy and immune therapy. And both work in a kind of very unique way that even when I was in medical school, we didn't really understand.
Wow.
So immune therapy is a way to get the immune system to recognize the cancer cell. So I'm giving you a medication that doesn't attack the cancer itself. It is training your T cells, it's training your immune system to recognize a cancer that's been hiding in the immune system, right? You have these receptors. So that's immune system. Very interesting, immune therapy.
Yeah.
Then you have targeted therapy. So instead of chemotherapy, where you give the patient chemotherapy, which is essentially poisoning the whole body.
Yeah, exactly. And the side effects are really hard.
They're terrible. Yeah. I mean, now you have targeted therapy where you recognize the gene mutations in each cell, in each type of cancer. And this is becoming more advanced as, AI is becoming more available. And you attack the cancer itself without necessarily attacking the other parts.
Is lung cancer more common in men or women, and why?
Lung cancer is more common in men, generally because men are historically the major smokers.
Yeah.
But the rate of lung cancer in women has gone up since the 1990s. So the 90s, the early 2000s, and now. So it's still where women are getting lung cancer at a much higher rate than they were before.
Maybe because of the smoking.
Honestly, it's socially more acceptable around the world for women to smoke. Their exposure to not just secondhand smoke, but different pollutants. And the fact that, again, they're getting older. People, as we get older, we are more likely to develop cancer.
Talking about the secondhand smokers, tell us more about it.
The surprising thing about smoking is that it creates these things we call toxicants, right?
Yeah.
Things that actually cause cancer. And depending on who you read and what country is regulating the cigarettes, you have hundreds of chemicals that are formed when you burn tobacco. And those chemicals are not just chemicals that, create smoke or help give you nicotine, but also can cause cancer. Among them is like formaldehyde, just off the top of my head. These things they're not stationary. They're in the smoke itself. So you inhale it deposits in your lungs if you're smoking, and then of course when you exhale it, those same toxicants are in those same smoke, in that same smoke. So the people around you are now subject to the same poison that you're inhaling for yourself. And this is why there was a huge effort in the late 1990s and 2000s to stop people from smoking in restaurants and bars and airplanes. I'm old enough to remember there was a smoking section in the airplane.
Yeah, everyone telling that. Yeah.
And now there isn't one. And thank God for that, because literally this is a cancer risk for people.
Okay, doctor, let's talk about the lung transplant and cancer or non-cancer. Tell us more information about it.
Lung transplant is something that has been advancing throughout the past 10, 15 years. Used to be, we would tell you need a lung transplant, and it was almost like a realization of a death sentence for a lot of people. They would last 1 or 2 years. Now lung transplants are very effective. People are living longer with lung transplants. We're getting a lot smarter with the immune system. So people with emphysema, let's say people who have been smoking for many years, develop emphysema, chronic lung changes, lung injury, you can actually now offer them a lung transplant and potentially help them live a little bit longer. For cancer itself, it's really hard to decide if it's a kind of a viable therapy. It might be, and in rare cases, I have heard of it, but it's not something that is common enough for me to know.
Doctor, at the end of this delightful interview with you, what's your message for awareness regarding lung cancer?
I have this refrain that I tell all my patients. I have 5 recommendations. Stop smoking, stop smoking, stop smoking, stop smoking, and stop smoking.
Very easy.
That's the best one. And then if you are, which is common, don't feel bad, don't feel too guilty that you can't go see the doctor. Tell them about your smoking history and make sure that they screen you when it's appropriate.
The screening is the most important.
Screening can save your life.
Yeah. Thank you, doctor. Thank you very much.
All right, you're welcome.
Lung cancer is serious, but awareness, early detection, and the new medical innovations are giving patients more hope than ever before. And remember, every breath matters.